Hello, everyone. Thank you for joining us in this presentation entitled The Importance of Lung Cancer Screening and Smoking Cessation. My name is John. I'm a nurse practitioner at City of Hope, and I work closely with Ms. Sophia Young, and we are both part of the lung cancer screening and tobacco cessation programs at City of Hope. So we will be discussing lung cancer screening, and smoking cessation today. So what are the key statistics for lung cancer? As we know, lung cancer is the number one cause of cancer deaths in the United States. It takes more lives than the other four top cancers. The average age of the diagnosis for lung cancer is about 70 years old. So as you can see on the top statistic, over the years, the incidence of lung cancer has been going down. This might be related to the tobacco cessation uptake that has been happening, which causes more people to quit smoking. At the bottom of the slide, you will see the lung cancer relative risks of smoking by smoking levels and race, and you can tell from the slides that really there is a disparity among ethnic minorities in this country. The lung cancer mortality rate is showed in this slide. On the right side of the slide, you can see that the mortality rate of US counties that are rich has been about the same over the years. But compared to counties in the United States that are considered poor, you can see that there is an increased mortality among those counties. Again, also on the left side, you can see that there is really a higher lung cancer risk percentage among ethnic minorities. Now, what are the common risk factors associated with lung cancer? As we all know, majority of the lung cancer that are being diagnosed are due to smoking. About 80 to 90% is due to tobacco smoking. Other reasons why we develop lung cancer is secondhand smoke exposure, exposure to radon, radiation, asbestos, and also family history. The others tend to be smaller contributor to the development of lung cancer, such as aging, other types of occupation, and air pollution. So, can lung cancer occur in non-smokers? Yes. We may know someone who have never smoked in their life, but actually developed lung cancer. So according to statistics, as many as 20% of people who die from lung cancer has never been a smoker or never used any type of tobacco. Some don't even have any known risk factors, but this might be due to possible genetics. But there are things that we can do in order to lower our risk of developing lung cancer. Definitely do not smoke or don't start smoking. Avoid the exposure to secondhand smoke. In terms of radon, there is a test that you can do at home to see the levels of radon in your house. A healthy diet and doing regular exercise as much as possible, and also avoiding agents that are known to cause cancer. So when we look for lung cancer, what we actually look for are what we call lung nodules. And lung nodules can be like a spot, a shadow, or a cyst-like appearance in the lungs. Keep in mind though that not all lung nodules that we see are actually cancer. About 90% of the nodules that we see in the lungs are actually benign, and only 10% are malignant. you will see at the bottom of the slide the two major types of lung cancer. There is what we call a non-small cell lung cancer and the small cell lung cancer. In the non-small cell lung cancer group, majority of the cancer here are adenocarcinoma. About 50% or half of the adenocarcinoma type of non-small cell cancer is due to smoking, but you can see that majority of the people who develop squamous cell and large cell carcinoma are mainly smokers. Now, on the other hand, small cell lung cancer is usually 100% exclusive for smokers. These are the most aggressive and fast growing ones. And so usually the mortality for small cell lung cancer is higher than non-small cell cancer. But the good news in a way is that only about 10 to 15% of the lung cancers that we have are small cell lung cancers. And then the smaller type or the other type of lung cancer that we find is what we call carcinoid tumor, and they usually grow slowly and they rarely spread. So sometimes they are only being monitored, and then the discussion with your surgeon may be needed if this needs to be removed. So what are the common symptoms of lung cancer? As you can see that, one of the most common symptom is persistent cough, but you can also have blood in your phlegm from coughing, shortness of breath, unexplained tiredness, chest pain, or weight loss. And other symptoms can be hoarseness of voice, loss of appetite, trouble swallowing, or facial or neck swelling. But these symptoms can also be due to a lot of diseases, and that is why there's really no particular set of symptoms that is specific for lung cancer. The problem with this is that majority of the people who develop symptoms for lung cancer are usually at an advanced stage. And that is why it's very, very important when a patient is a smoker to determine if he or she qualifies, because we can find lung cancer early before some of the symptoms come out. And we will talk about it when we discuss lung cancer screening. Staging and treatment options. So for lung cancer, the treatment really depends on the stage when your lung cancer has been diagnosed. There are more options available now, but definitely the standard of care still stays the same. There's usually surgery and chemo or radiation, but I'll discuss at a later slide the new options that are available for other patients. Now, again, the treatment will depend on the stage when the lung cancer is diagnosed, and you have to talk to your surgeon or your medical oncologist about this. Now, as I've just mentioned previously, we only have surgery, radiation, and chemotherapy as the mainstay treatment for lung cancer. But now there is immunotherapy available for patients. It actually stimulates your own immune system to fight cancer. And these are not available on every type of cancer, but there are a lot of things coming out now in terms of immunotherapy, especially for lung cancer. There's also a targeted therapy that is very personalized based on different factors, and these are things that you can discuss with your provider if this is something that is applicable for you. Um, this is the latest information we have about smoking rate for adults. Nationally, we are at about 13.7% smokers, current smokers right now. California is a little bit lower than that. We are currently at 11.2%. LA County in general is slightly higher than the state of California at 11.7%. But Orange County, as you can see, has a lower percentage of 9% as of 2018. Now, this is the reason why we really need to focus on a few things, and that includes lung cancer screening so that we can detect it early, education and management for patients to quit smoking, and enhance and effective outreach for our diverse communities. So, lung cancer screening saves lives. Unfortunately, majority of the patients who meet the criteria for lung cancer screening have not done screening at all. Um, and we will discuss a little bit more about this as we go on, but lung cancer screening uses a low dose CT scan to help it be detected early. And there are certain criteria that a patient needs to meet in order for them to qualify. And again, we will discuss it the next few slides. So what is lung cancer screening? It is at least an annual check that involves the use of a low dose CT scan. Previously, chest X-ray is the standard of care plus or minus sputum cytology, but the use of CT scan can show us more detailed information than a chest X-ray. You probably heard about people who had chest X-ray and they said that they were doing fine a year ago, and then all of a sudden um, they they were diagnosed with lung cancer. The problem with the chest X-ray is that if the cancer is too small, it won't be picked up by chest X-ray, and that is where CT scan can be a better way for us to detect lung cancer. Um, the CT scan that you'll have as part of this screening program does not involve the use of a contrast dye. Um, Being part of the lung cancer screening program, there are a few steps that needs to happen. Before the actual screening, you have to talk to your provider about doing what we call a shared decision-making consult to discuss the risks and benefits of being part of the program, and also offer tobacco cessation counseling if they're active smokers. And then you will be scheduled to have your CT scan. There's usually a very, very minimal preparation, and it usually is a fast CT scan when you actually do it. And then after the screening, your ordering provider will discuss the results with you, and then will let you know what is the next step. Um, in order to be part of the lung cancer screening program, several criteria needs to be met. First of all, is that a person needs to be either a current smoker or a former smoker. Um, Now, if they are a former smoker, they should have quit within the past 15 years. Okay. Second, they should also have about 30 pack year smoking history. And uh, when we calculate it, it's about one pack a day for 30 years or two packs a day for 15 years. And the calculation can be a little tricky, but you can contact us, or you can contact or ask your providers about this. Also, the patient needs to be between 55 to 80 years old. But right now, if you're a Medicare or Medicaid or Medi-Cal patient, they usually cover until the age of 77. But Um, Things may change soon because the U.S. Preventative Services Task Force actually updated their recommendations, and we may see patients being authorized to do a screening CT scan starting at the age of 50, and may even need less than 30 pack years. So um, you can ask your provider for any updates on this, but we are hoping to see that soon so that we'll have more patients in the program and also help more patients to detect lung cancer early. And then also for your first or initial CT scan, screening CT scan, you should not have a chest CT within the past 12 months. As mentioned, part of the discussion between you and your provider is the discussion about the risks and benefits of being part of the lung cancer screening program. Definitely, as we all know, that the earlier that we catch something, the better, because stage one lung cancer is more curable than stage four. Also, when they did the study, they found that there is at least 20% reduction in lung cancer mortality when they did the CT scan, the low dose CT scan, compared to a chest x ray. Another benefit that is associated with the lung cancer screening program is that you improve your quality of life, and also we do discover some other significant health diseases such as COPD, or if you have like plaque buildup in your heart arteries. Now, there are definitely associated risks with the program. And again, this will be discussed in details by your provider, but it may include anxiety while waiting for the test results. Also, because it's a CT scan, you may be exposed to radiation, and we'll talk a little bit more about it. Now, um, everyone gets nervous when they are waiting for results of their health test, um, but sometimes the anxiety that is associated with the uh, diagnostic study can also be considered a teachable moment, especially for those who are current smokers, and see if that might be a good time for them to talk about quitting smoking. Now, what patients can do in order to alleviate this is that they can do some type of relaxation, meditation, distraction, or other things that can help them cope while waiting for the results. Um, some patients are concerned about exposures to radiation. And again, this is a CT scan, so there is an involved radiation exposures with. But the good news is that the CT scan that is being used for lung cancer screening has low dose radiation. It definitely has much lower radiation compared to a regular diagnostic CT scan. And when you compare the risk and benefit between exposure to radiation or not, I believe that for someone who is considered high risk for lung cancer screening because of their smoking history, the benefit really outweighs the risk about exposure to this low dose radiation. Um, you might be asking too if this lung cancer screening CT scan is covered by your insurance. Medicare, Medi-Cal, and most private insurance usually covers this scan without cost of sharing, again, as long as you meet the criteria. Some commercial insurers will ask you to have a prior authorization first prior to the CT scan, or Sometimes private insurance may require you to meet your deductible or pay parts of your deductible for these tests as well. As mentioned earlier, a shared decision-making consult is required before the first CT scan. This is where the risks and benefits and what to expect in the program, what's the next steps will be discussed by your provider. And this is the time when you ask questions to your provider and also ask them if it's really the right screening program for you. Okay. Also, at this time is the time for the provider to talk about smoking cessation if the person is a current smoker. There is a eligibility questionnaire that the City of Hope created in order to check and see if you actually qualify or will qualify for the lung cancer screening program. You can go to https://is.gd/lung cancer screening, and it's currently available in English and Chinese, and we are currently translating it into Spanish, Vietnamese, Korean, and Armenian languages. There is what we call a screening center of excellence, and these are medical facilities that provide high quality low dose CT screening for early detection of lung cancer. They also comply with comprehensive standards based on best practices. So this is very important information because it helps navigate. They help navigate patients through the program, and I am pleased to inform you that City of Hope actually is a screening center of excellence for lung cancer screening. We are comprised of a multidisciplinary team who will help you from the beginning about evaluation and possible treatment if we detect nodules on your CT scan. Our team includes providers from the pulmonary department, radiology, thoracic surgery, interventional radiology, and medical and radiation oncology team. And again, it is important to, if you have the means, to find a place that is considered a center of excellence. Because in case cancer is detected, then you have immediate access to this multi-specialty team that can provide you the necessary information so you can have a very informative discussion and also decide on what's the best approach in case you are diagnosed with lung cancer. City of Hope main campus is in the city of Duarte. We are located near Los Angeles in Southern California, and we are a nationally recognized leader in research and treatment of lung cancer. We are a designated comprehensive cancer center by the National Cancer Institute. And again, as mentioned, we are a screening center of excellence for lung cancer screening. We have been for more than a decade named as one of the top cancer hospitals in the United States by the US News and World Report. And we have been named as well as high performing hospital for lung cancer surgery. Again, we have been one of the forefront in lung cancer and lung cancer treatment, and we offer leading edge technologies that includes the new robotic bronchoscopy that helps in early testing and early identification of lung cancer by obtaining samples of the lung tissue. And also we have minimally invasive video assisted thoracic surgery and robotic surgery that can be used nowadays. We have also recently opened City of Hope Orange County in Newport Beach, and we are launching that screening program for lung cancer screening there. Um, as many of you might know, we are also in the process of building a state-of-the-art City of Hope Irvine Medical Center that will be available to service the public in a few years' time. So we've talked about lung cancer and we've talked about lung cancer screening, and lung cancer screening is great in the early identification of lung cancer, but another important aspect in order now to cut down your risk of developing or being diagnosed with lung cancer is tobacco cessation. The National Commission on Prevention Priorities identified tobacco use screening and cessation interventions as the highest priority for clinical preventive service for adults in the general population. There are so many short-term and long-term benefits and health outcomes of quitting smoking. And as mentioned earlier, when we do the lung cancer screening, it can be a teachable moment wherein we can discuss tobacco cessation with patients. This slide summarizes the many effects of tobacco use in our body. It actually affects all the 30 trillion cells in our body, not just cigarettes, but also e-cigarettes. And tobacco is associated with more than 480,000 deaths annually, and that includes deaths from secondhand smoke. Aside from lung cancer and COPD, people can develop different type of cancers all over their body, and also can have, for example, premature aging and wrinkles. Also have stomach ulcers, vision loss, and for men, sexual impotence, and for women can have ectopic pregnancy. So again, it does affect every single cell in a person's body. Benefits of quitting. There are so many benefits of quitting. With more than 7,000 chemicals in a lighted cigarette, you can eliminate that by quitting smoking. And as early as 20 minutes, there are already changes that is happening in your body, such as your blood pressure and pulse rate returning to normal. For example, as well, at 10 years after quitting, your risk of dying from lung cancer is much, much lower compared to when you are still currently smoking. Again, there are so many benefits to it, and what we always tell our patients is it's never too late to quit smoking, even after a cancer diagnosis. So we've talked about tobacco. We know more about tobacco, but we are now having this issue as well with e-cigarettes and vaping. E-cigarettes actually came about around 1960s, but it didn't prosper at that time. But the modern e-cigarettes actually came out around 2003 by a Chinese pharmacist. And his idea for introducing e-cigarettes was actually to help him quit smoking because his father died of lung cancer. And at that time, this person was a 3-pack smoker of cigarettes before. Unfortunately, he was not successful in quitting, and he ended up being a dual user, meaning he is smoking both e-cigarettes and cigarettes as well. We still don't know a lot about e-cigarettes. One is because it's the newest of the products that are being offered, and also there's still not much information about the long-term effects of e-cigarettes. What we know right now is that it can cause some lung and heart injuries, like what we call EVALI, e-cigarette or vaping product use associated lung injury. And we probably heard about someone who had to have a double lung transplant for this. Um, but also, there are still a lot of unknowns related to e-cigarettes. I also do want to mention that um, the problem with e-cigarettes is not necessarily the nicotine. Nicotine doesn't cause cancer, but it's usually the flavorings in the e-juice, the e-liquid that can cause harm to your body. And that is why up until this time, we are still not recommending the use of e-cigarettes as a means to quit and help people to quit smoking. This slide shows several disparities in the United States with adult smokers. As you can see at the top left, that race, ethnicity really plays a role in terms of smoking. Ethnic minorities are smoking more compared to Caucasian. Also, people are who has lower education tends to smoke more. People who are below the poverty, who are disabled, who are members of the LGBTQ community, and those who are psychologically distressed tends to have more smoking than than their counterpart. So in order to help patients quit smoking, we always and we tend to have the 6 steps available for them to think about. Number one is to determine their reasons for quitting and to help make up their mind. And also, we encourage them to be confident that they can take the action to quit. It's never easy to quit, but the more that you try to quit, the higher is your possibility of being able to quit successfully. Second step is to your quit day and make a plan about it. Third is preparing yourself to overcome some of the triggers or some of the habits that are associated with your smoking. That is very, very important because tobacco is both has both psychological and physical dependency. Number four is be prepared to manage the cravings by using appropriate quit aids and also medications. And there are several medications available, including over-the-counter medications to help manage the cravings. Number five is getting rid of the smoking reminders to make things clean and fresh. And, other things that patients can do with this step is just to avoid places or areas that remind them um, of smoking. And last, that it is okay to seek and receive extra help and support that you need in order to quit. You can talk to your current healthcare provider, to the quit line, as there are so many valuable resources available for patients in order to help them quit smoking. At City of Hope, we use these evidence-based guideline recommendations in order to help patients quit smoking. The first one is stopping the withdrawal by the use of medications. Two is helping them break that habit links that are associated with their smoking, such as informing them, educating them about delay and distracting techniques. Third one is having a support with their family, of course, and also with the use of support group. And I will tell you a little bit later about the available City of Hope support group. And fourth is managing relapses because, as we know, tobacco um, uh, addiction is if you're addicted to tobacco, you are at higher risk of having a relapse or going back to smoking. So we help patients navigate through that and prevent relapses from happening. As mentioned, we have a free virtual cessation support group at City of Hope. It is currently being offered in English every Monday from 3 to 5 in the afternoon via Zoom. You are all encouraged to join us. If you know anyone who needs help to quit, you are invited to join us. You don't have to be a patient of City of Hope to be part of the group, and then we can um, talk about smoking and ways to help you to quit smoking. Also available resources for you are California Smokers Helpline, the Quit Line, that are being offered on several languages, and then also a smoke-free text and other mobile apps that will be able to help and guide you in quitting smoking. For more information about our program, both lung cancer screening and tobacco cessation programs, please visit our website at cityofhope.org, or you may contact us at the phone number listed or email us at the two email addresses for our programs. And with that, I thank you all for listening, and I am ready to take in if you have any questions. Thank you all for your time and listening to our presentation.